hours, we only reported 159 new cases, which are below the expected projection of 300 per day as the surge peaks. We want to continuously implore all our people to work with government in the fight against this virus by taking all precautionary measures at all times. Our people must wash their hands with soap and water, sanitize, wear a mask whenever you are out, and maintain social distancing at all material times. We wish to also encourage our people to support all those who test positive and desist in stigmatizing them. A few months ago, in April 23 to be exact, I led the Command Council to Beggarsford practice here, in particular Steelport, on COVID-19 adherence monitoring program. Behind the Beggarsford Mall, we found a place called Extension 10, which actually is an informal settlement. An attempt for social distancing in that area, in our assessment, would be futile. It will not be practicable. It wouldn't have been practical to have social distancing in that particular area. In interacting with those communities, they all called on the Premier and the province to find an immediate solution. Turning to Talan. On Talan, transitional residential area in particular, the PCC has noted concerns raised by members of the public and directed to Limpopo provincial government in respect of the type of units built and subsequently handed over to the families concerned, as well as the costs involved. It must be stated from the onset, ladies and gentlemen, that this is a national project of the Department of Water Affairs and Human Settlement, implemented in all 9 provinces in the country. It was not just Talan. In this regard, the department has appointed the Housing Development Agency as a project manager to help implement this program on its behalf. Remember, the Housing Development Agency is an entity of the department. It's not a private sector unit. Underpinning this program, is a commitment by the national government to provide a COVID-19 emergency relief to communities who live, in particular to communities who live in a densely populated informal settlement, through the following: the de-densification or partial relocation to enable community to practice social distance and reduce the spread of the coronavirus. Provision of transitional residential units, temporary units must also be built or established or erected to relocate households. Housing Development Agency, HDA, as a project manager in this regard, was therefore appointed to, amongst others, to undertake stakeholder consultations for resource allocation and buy-in, develop the necessary social impact, assist municipalities to identify structures and people to be relocated, to survey and site layout for orderly settlement, and above all, develop specifications for units to be used and any other related budget for procurement. In this regard, the concerns raised regarding the cost and the type of units can best be addressed and responded to by our counterparts at national level, in particular the HDA and the National Department of Human Settlements. That is why you see the DG being here. I am sure that the HDA colleagues from HDA are also here amongst our midst to clarify all the questions that you are raising. Worth noting, however, is that in our province, the Department of Coxta in Limpopo prioritized Talan Hostel as one of the informal settlements to be de-densified in order to adhere to the principles of social distancing. Due to a high demand for affordable residential accommodation in close proximity to the Zanin town, the hostel became overcrowded, which later resulted in the mushrooming of informal structures around the hostel building, the building called Talan. And as a result, that is why we ended up submitting this project to the Housing Development Agency on the 8th of May 2020 as our implementing agency, or as implementing agents for establishment of a transitional residential area as mandated by the national department in question. Nevertheless, we would like to acknowledge that a reference to multi-million project in the statement issued by our communicators prior to visiting the Talan was unfortunate, as it has also contributed to some of these concerns, to some of the confusions. As the provincial government, we indeed are at a very advanced stage to translate the Talan old hostel into a modern community residential unit to benefit 168 families with business and recreational facilities. An example of this project is the one that we built in Seshio. This is the multi-million rand project that we were talking about. This relocating of them to temporary shelters was the phase one of that project. Basically, which says you relocate them to temporary unit so that you can deal with the question of social distancing. Whilst in the process, you are busy building a permanent settlement for the people. Lastly, corruption remains a great concern for this government. This I will repeat at any platform, and when addressing the media at Talan last Friday also, I said it in no uncertain terms that COVID-19 has not given us an opportunity to pillage the public coffers. I remember I actually even used a very strong statement that we are not going to allow vultures, any vulture to come and feed on the corpses of our people. Because I had anticipated that such kind of sentiments may arise, more especially if people don't have sufficient information. Ladies and gentlemen, I must commend the President of the Republic, President Ramaphosa, for leading from the front. When he signed the applicable protocols of investigations by the SIU, Hawks, NPA, and all other law enforcement agencies, he showed how serious this country is about fighting corruption. People must remember that all exposure of corruption were initially exposed by the very government led by President Ramaphosa. I therefore would want to implore on you, the people of Limpopo and the media alike, to join the President in fighting this corruption that continues to manifest its ugly head in our lives. Corruption is our new enemy, ladies and gentlemen, and corruption is with us. It is our choice to make whether we want to live with corruption or we want to fight corruption. I must also deal with the issue of sending wrong or perhaps misinformations to our people. I have never spoken to any journalist, including Sowetan and Mangoba from ETV. I've never spoken to those journalists. But they have quoted me in first-person terms. I did not know, says Matawata, when they never spoke to me. I think that is wrong. It should not happen again. If you did not talk to me, quote me in second-person terms, because you did not speak to me. Either you spoke to my spokesperson or somebody, second person. You did not speak to me, sorry. It's only after you spoke to me when you can say, Matawata says, I did not know. Never said to anyone that I did not know, that I'm going to unveil or launch the temporary settlements in Talan. I've never said that. So the question of I did not know was very unfortunate. And I heard it being repeated by other media houses, more especially ETV last night. But I was asking myself, Mangoba, who did you speak? Which Matawata did you talk to? You know, somebody has developed his own Matawata elsewhere, who's not this one. But if you did not talk to me, please don't say you spoke to me. I never said to anyone that I did not know. And I want that to be corrected. I knew that we are going to unveil temporary shelters there. Thank you. Thank you.
It's a privilege to be sprayed by the chief protocol person. He's never done that to me. So, thank you, Mr. Premier, and all those that are on virtual platforms. I know we have been joined on virtual platforms by the MEC for Transport and Community Safety, Mabunguru Rodi, and MEC for Social Development, Mengakaring Rahwale, and several other HODs of departments virtually who are watching us on this space. We will, for now, we will allow if there's any comment from the Director General for Human Settlement National. You can come up here, please. Just a short comment and then we take it from there.
Thank you very much, and good afternoon, Premier, MECs, colleagues, ladies and gentlemen. I suppose it is necessary to confirm that part of our upgrading of informal settlements program requires that where settlements are dense, you de-densify them so that you can develop them properly. Because it's not possible to develop a settlement when people are staying there and crowded. Secondly, there is indeed an emergency housing assistance program that allows for provision of temporary housing for those communities or households that may need it due to emergency or some other threat. Further to that, we have put specifications, norms and standards, they are in place. All of the technology, building technologies that are available are accredited by both the Agrima Board of South Africa and the National Home Builders Registration Council. So, what you will find is that even in Talana, the Housing Development Agency has had to go back into the register of approved providers of this technology, and therefore ran a procurement process to appoint an appropriately accredited contractor to build the units. As the Premier indicated, it was unfortunate that the communication mixed up the issues. Indeed, it is normal that the executive can go and visit and check, are these units being built, how far are they? And we were very happy with that. Now, because there has been concerns about the quality and perhaps the workmanship, we as the National Department have a duty to independently review the units there. So it's fine. We will ask the National Home Builders Registration Council to review whether there is indeed quality failures on those units. We will make sure that we submit that report, MEC Premier, to the Minister, to yourselves, if indeed there is any quality gaps. But further to that, we confirm that the Housing Development Agency is tasked to support provinces and municipalities to deliver on these temporary residential units across the country. The reality, ladies and gentlemen, is that there are far too many people who are staying in overcrowded spaces. And therefore, that poses many dangers to them, even under this pandemic. So, while we'll provide service stands as part of the overall program, while we'll also provide rental accommodation in terms of social housing, we will also provide temporary residential housing units to help those households not to be congested. So the intention is to help decongest as quickly as possible. And therefore, Premier, I thought I must just deposit that perspective here, and we will confirm very quickly the review of the quality assessments there. And if there's anything that requires to be clarified, we'll clarify that. But the essence, ladies and gentlemen, is simply that this is a national program. It's in the housing code, the human settlement code. There is nothing that we can do that is not in the code, which provides the technical specification, under what circumstances can this be done, what is the cost limitation, what are the norms and standards. So the program is in place. Thank you very much. I thought I must clarify that.
Thank you very much, Mr. DG. We're still live on our Facebook social page, although the network in here is sometimes problematic. But I must commend the social distancing that you have applied here. And I've suddenly realized we all look very beautiful with our masks on, because our eyes are very beautiful. I wonder what will happen when such time comes where we have to take the masks off. Thank you very much. We are going to a question and answer session now. You're welcome to ask any of the panel in here questions related to the statement. The statement is on your OTP WhatsApp. It has been sent to everybody. We're going to stop printing papers very soon. So anybody who can't access virtual, electronic, it's unfortunate. Tomorrow's world, it's not on papers, it's virtual. So let me see hands for questions. You know the drill, you identify where you come from. It has been reported. We have all the MECs, MEC Public Works and MEC for Health and MEC for Cockstar, the Director General for Human Settlement, and I believe there are colleagues from the HBA. I see SABC, ETV, News, Werk, and you will identify yourself. Let's start there. We'll take 5 questions, and NHFM, and we'll take 5 questions, and then please identify who you're sending the question to. Thank you.
Thank you, Matiwa. Premier Piman Baloi from SABC News. Premier, I have 3 questions. The first one is you explained that the HDA has been roped in to assist, and you explained some time frames. I had the 8th of May, and I'm not too sure, were they roped in when the crisis happened? When you said there's a backlash from the members of the public, were they roped in when that crisis started, or even prior, when the entire process, the entire project was thought of? And then my second question, you mentioned that the initial communication statement that was sent to media, members of the media, that I myself also received, stated that these are low-cost housing units that you were going to hand over. But we only learned, I was there when you unveiled them, we only learned when we got there that they were not low-cost houses, and they were the units that they are. Are there any actions that are going to be taken? Because you are directly saying there was a miscommunication. There are people who work within either your department or MEC Makamu's department who have compiled that communication. It could have been with the intention to to push a certain narrative, to misinform members of the public and members of the media. Are there actions that are going to be taken against some of the people who are responsible for these media statements? And also, you also mentioned, my third question, you mentioned that you were not happy with the way Sowetan specifically and ENCA handled the story. Are there any actions that you're going to take? Because you are saying you were misquoted, you were put in there when they had not spoken to you. Thank you, Premier.
Thank you very much. Who is next? Yeah, ETV.
Good afternoon, colleagues. Tabo from ETV. So, Premier, there's ETV and I have my colleague from ENCA, 2 different but related media houses. My question pertains to the cost of these temporary houses that were built. When you mentioned in your speech, you said that the multi-million clause is referring to a broader plan project, but I want to have a specific answer towards what is then the cost of these houses. Is it still projected that each unit was 64,000? Is the 2.4 million mentioned accurate? And if so, the government of Limpopo, can we get a response into the rationale that informed the decision that a temporary house costing 64,000 rand per unit would suffice at this stage, as opposed to an RDP house, of course, which would be a permanent solution to those people who have a permanent housing solution? Should we have not maybe seeked out lesser expensive, inexpensive avenues for temporary housing, so to say? Thank you.
Sadiki?
My name is Mashudu Sadiq. I'm from Media 24. I suppose the vetting process would have gone through the National Human Settlements Department and not Coxstar. So I guess the DG will take this one. It now appears that the company that was elected to do these structures is notorious for inflating prices especially when they're doing business with government. Did the vetting process take place properly with this Aventino group? And if how did they go through to win the tender?
Thank you very much. Energy?
Thank you very much. My name is Emmanuel Quinda, representing Energy FM and Choice FM. My question was about the misquoting that the Premier has just mentioned, to say that he's said to have said things that he didn't say. So I wanted to check if whether he's going to take those media, I wanted to check if the Premier is going to take those media outlets that he's claiming to say that they've misquoted him to task. But thanks, because my colleague has just posed that question. The other question is with regard to the cutting of the ribbon. I'm sure, you have seen it. Even one of your ministers, Fikile Mbalula, did tweet criticizing that exercise, to say that you don't cut a ribbon when you are launching temporary things. So I don't know if maybe the Premier will also like to clarify that as well. Thank you.
Thank you very much. Can we avoid repeating questions? If it has been asked, please, we are on a race for time.
Okay.
Thank you.
Thank you, Premier. It's Mangoba Mchunu from ENCA. Premier, thank you for acknowledging the fact that you have, in fact, were aware of this project. So my question is, you have said that this is a national department project. So I just want to understand the role that the province played in this, because I'm sure that the province would have identified this area together with the municipality as one of the areas that need intervention. So just in terms of where did the approval come from? Did it come from the province, or is it totally a national issue?
Thank you very much. We will take the last question from University of Venda FM. Chitabane Mashudu, you have raised your hand. Can you unmute yourself and your picture so that we can see you and say your question? Chitabane, can you hear me? Can you raise your voice? Gosh, it will be very difficult. I'll have to repeat the question. Can you? Yeah.
This is Mashudu from Union FM. When the Premier was speaking, he outlined that the number of healthcare workers that are being affected are growing rapidly. So, as the provincial government, what is it that they're going to do to ensure that the number drops in the province?
Can you just repeat it again?
I was asking the Premier while he was talking, he outlined that the number of healthcare workers that are being affected are growing rapidly. So, as the provincial government, what is it that they're going to do to ensure that the number drops for healthcare workers?
Okay, thank you. He asked that the Premier, in his address, said the number of health workers who are infected are growing. So, what is the provincial produce those numbers. I think the MEC for Health is here. Mr. Premier, you can come and respond to those questions. I hope you who are virtual are able to hear us. Thank you very much.
Thank you, Kenny. I'll take some of the questions. The most difficult ones, I'll leave them for the MECs. Imani, where was the HDA all the time? That's your question. All the time you mean from Friday to date? No. Like I said, when we were busy with our pushback strategy, we visited a number of areas and we identified these highly congested areas. And I remember when we were in practice here, I actually said to the MEC, you must do something about this immediately. And he immediately said, there is this project, human settlement nationally. Perhaps we can see as to how it kicks in, we bring it into our province. And I directed him to work on that, which is a project of bringing temporary shelters to assist people during that time. I think the DG or the HDA people who are here will tell you about this project as to how it operates. And when I was addressing on Friday, I actually tried to go at length explaining what the HDA was saying to us about the project. Maybe the media houses who were there just thought, the project. But I think they will unpack it, or why this particular project in particular. But they were there all the time. They were there with us all the time. It's unfortunate, like I said, that maybe the communication did not go out very clearly. You know, when you communicate with many people, you must make it a point that you are very, very thorough and detailed, so that nobody must misunderstand you. Hence, I said, when we went there, and this also addresses, there is somebody else who raised the same question. This also addresses that question that says, did you know? I knew exactly that we are going to unveil temporary shelters. But at the same time, we are kicking in a multi-million rand project, which at this stage is still at phase one. Phase one of which is feasibility study. Feasibility studies. And whilst you are doing that, you can't say, because I'm still doing this feasibility study, I'm going to build. Building takes a long time. I'm going to build. I am going to leave these people in that congested area until such time that they pick up COVID-19. You must arrange a temporary solution for them. As to at what cost, I think the department will come in and the DG to explain as to why 64,000 rand for that shelter. But when it was unpacked to me, the quality, the features of the shelter, I felt probably it is the right amount of money. I don't know. I'm not an engineer. With that, by inspection, in mathematics they say by inspection, dear inspection, which therefore means that you did not go into detailed analysis of the work. But by inspection, I felt it makes sense. These people who misquoted us, the first course of entry to Sowetan and Mangoba's, is it ENCA? You say ENCA and ETV is not one and the same. The first point of call would be, which we have already started, to talk to the media houses concerned. We have already spoken to Sowetan. We had a meeting with them yesterday. We'll have another meeting with them today. If we deadlock, I think there are mechanisms in this democracy that says, if you deadlock, what is the next stage? But currently, we are talking to them. We are still talking to them, and I hope we will not deadlock. But if you deadlock, there will be some other cause for action or cause of action. There is no initial statement that says, I learned on arrival that these are temporary shelters. I don't know where people get that. And I tried to explain it. You know, on Tobela FM, I was even very clear because I was doing it in Spade, it's my mother tongue. I don't know, really. I said, I learned on arrival that I'm going to unveil temporary shelters. I knew, the MEC briefed me that we are going to unveil temporary shelters, but at the same time, unleash a permanent project of CRUs, community residential units. Hence, I'm saying perhaps the communication was not very thorough. That is why there was this kind of confusion. People thought when we talk of this multi-million rand project, we are talking about these temporary shelters. No, when we spoke about the multi-million rand project, we were talking about the entire project, which currently is still at phase 1. It's phase 1. I'm not going to respond on the cost, like I said, the DG and the department, the MEC will do that. Energy FM, I think I've already responded to that. Are you going to take action against these people who misquoted you? I think I've responded to that, unless if you are not satisfied with that. The issue of the cutting of the ribbon. The issue of the cutting of the ribbon, maybe you are right. It was too premature. Maybe we should have waited, MEC, for the entire multi-million rand to be completed and later cut the ribbon. Because now people think you are cutting the ribbon, ushering people into temporary shelters as if they are permanent shelters. Maybe you are right. That was premature. And there is a lesson learned. It will not be repeated, I can guarantee you. What role did the province play in these temporary shelters? I suppose maybe this is time maneuver that I can leave you with my bioscope here to come and tell you. Because I was watching your bioscope last night. Today you must watch my MEC. Sorry.
Thanks very much, Premier, fellow MECs and DG Human Settlement and our provincial DG, the Chaveling. I will try to answer some of the questions, starting with the first one that the Premier said his own BASCOP will come and clarify. That we are saying that this project, it's a national project because it's done in everywhere in the country. But the question is, what is the role of the provincial government in the whole matter? I must say that when the coronavirus started, as a province we identified about 8 sites which are said to be highly congested. About 4 of them are found in Lipalale in the Waterberg district. One is Talani that we're talking about today. The other one was Beggarsford site, extension 10. When we were at Beggarsford, the Premier said to me when we were physically seeing our own people congested and you could not be able to identify whether it's a one household or what is happening, and gave the clear instruction at that point and say, MEC will need to do something in this case. I came back, I worked with the National Department, and that project was approved by National to densify Talani and Beggarsford extension. So the role that we played as a province, first it was to identify the sites which were supposed to be densify. So it's our responsibility to identify. National never identified Talani or Beggarsford. It's our own. Realizing the challenges we saw. And I think the Talani one, it's a fact that the congestion which is there, we have seen it, and I can say it is, even if you take from the human rights point of view, we were supposed to respond on the challenges our people were facing there. And that's exactly what we have done as a provincial government to resolve such challenge. And I think we looked on the issues or the structures which were supposed to be used. The question we will ask ourselves as a department is the temporary structure that we want, are we looking for the tents to put which were there? And I think you know, some of you who were there at the time in 2017, where we lost 3 lives in Talani because some were staying in tents. So you had to make a choice on whether you still continue with some of the things that have failed before. Hence, we took these structures that we were able to assess, and as we were using national department through the HDA, to say we want structures which are temporary, which are being used everywhere in the whole country. That's where we came with a structure. And it is true, personally, I knew that each structure is costing us 64,000 rand. I can not only explain the specifics which are there, but I have been explained, but today I believe I have people who can able to clarify more that what we call mukuku might not necessarily be the same as I go to the shop myself and buy some corrugated irons and construct on my own. It's a structure that has been done, has been assessed, has been said to be passing certain SABS standards. And I think DG and HDA here, in that specification type of, will be able to help me clarify. And I think that's one of the issues. Premier spoke about the issue of the communication vis-a-vis the project that we want to start in that particular area, which is a community residential unit. When you talk about low-cost housing, you will also talk about the land that will be available. The issue of Talani is not necessarily a simple matter on the basis that you can say you can go and build RDP houses to the value of 168 households, because you require land that will be utilized for that. And if you look where people are, now now located. It's not even a big land that can be able to have the RDP houses if you are to talk about decent houses that we should give our people. Hence, we are talking about creating a CRU, which will be a hostel of some sort, but we have improved the life of our people in terms of the hostel dwelling. A hostel are places where you will find only males being accommodated there, and our fathers were being accommodated in hostels when they were still in Gauteng. What we are going to build in Talani is not a hostel. It's a CRU which will have family units that will be able to accommodate a family who are working closer to town. But you can't even take those people and give them maybe in Dan Extension or in Kowankowa because they think they want to be closer to town. So the issue of the low-cost housing in the area is out because you will not have the land to can locate those other people. The land is expensive within the town. So the only solution is to do the CRU. And that's what the Premier, as we're noting the temporary structures, we were kicking in that we are coming to launch the CRU, which in his statement indicated that we have done it in Seshego. Currently, it's under construction in Lipalal. It's called Marapong CRU. So it's not something that we are running away. We think it's not something that we are doing. It's part of our business plan, which has been approved by the National Department, and we are busy with it and will be able to complete it. So I think those were the specific questions. But the other issue, I think HDA will come to say this contractor, Aventino, is notorious for charging high prices. One thing I've learned since I arrived in the human settlement sector is that there are quantums. When you bid in human settlement, you don't necessarily build and give your own price for a particular household. If you build an RDP, you show us your functionality, but the price is determined after checking all the other things, and it's determined on that particular structure. But I should be able to indicate that the procurement process for this project was not done within the department in the provincial government. It was done through the HDA. All the supply chain processes that were followed, and I think HDA can be able to clarify, it was appointed at the national level, not even at the provincial office. We only knew somebody who is implementing on behalf of us, who has been appointed, and that is how we are working within our sector as housing. So I don't think if he's notorious for charging high prices, he will have an opportunity because the quantum of 64,000 is set at the national level, and the DG can come and confirm that. Even when you build a low-cost housing, a quantum is set at that level. We just simply appoint you on your capacity and the other BBE professional procurement policy matters. But the price is determined already. So, of course, Premier spoke about the issue of the journalist and the content of the communication. The Premier's office is informed by the champion department, and in this case is Coxstar. As the MEC responsible for Coxstar identified the defects of communication within the department, I'm definitely going to sit and be able to take action in terms of how we can be able to improve such a challenge, because I have realized how it costed the provincial government, the manner in which we miscommunicated with our public. Thanks very much, Premier.
Thank you very much, Mr. MEC. MEC for Health, Dr. Popira Matuba has got a question, a response to make on the question that was sent. Some of the colleagues said they didn't hear the questions. The question MEC Popira Matuba is responding relates to health workers and the number of those that are infected going up. MEC?
Thank you, and thank you to our Premier, the DG, both from national and our DG in the province, and the colleagues the Executive Council, and of course colleagues from the media houses. Yes, indeed, it's true that the Premier and the PCC is concerned about the increased number of workers, healthcare workers, that are getting infected. And if you look at, we need to firstly appreciate the fact that healthcare workers are part of the community. So as we experience a surge within the community, equally the healthcare workers, firstly in their own right as individuals, they are not immune from getting infected. And that's why you will see that the increased number of health workers that are infected, it's also in line with the surge that we're experiencing within the community, because now we are dealing with community community spread. Now we are also saying, because the question is also, what is it that we are doing as a government to mitigate that? What we are saying is that if you remember in a number of our PCC reports, the Premier has always been insisting that when it comes to provision of PPEs, it's something that we don't compromise as a province. Even for us to delay to launch in the beginning, if you remember on the 14th of April, when we delayed to do household screening, when everyone, most of the province had launched, you asked us, why are you taking time as the province? And we said, we need to make sure that there's no community healthcare worker that goes in a household without PPE. So we had to make sure that we have enough stock of PPEs to make sure that all our healthcare workers, firstly, they protect themselves. And we are also, secondly, as a province, have taken a decision that no healthcare worker is allowed to touch a patient without wearing the proper PPE. If you are a security guard, there are PPEs that are defined for you to wear at that level. If you are a nurse working in casualty, you also have got standards of PPE. If you are working in the COVID-19 ward, you also have got that standard. So we are not compromising as government in that particular field. So actually what we even resolve is to say, if I'm doing probably the ward rounds or surprise visit in hospital, and I find a health worker, a nurse or a doctor not wearing PPE, we are going to charge him for endangering his life and also endangering the life of the patients. So we have done that as government. So what is left is the education towards our healthcare workers so that we practice what we preach. One of the areas that we have said is that issues of social distance, we don't practice them as healthcare workers in our facility. We've got, you know that we do have our nurses' tea room where we go and sit comfortable. Immediately when you get to the tea room, this is what you do. Because you want to detox, you want to talk to your colleague, you want to tell them your frustration. So that is the one that is risking us from getting infected, because we are comfortable when we are with each other. We think we are immune from getting infected. So that is one of the policy that we negotiated with the unions to say we're going to stop these tea rooms so that we compromise. We are also designing that we must take turns when it comes to tea breaks and lunch, so that we don't go out in numbers, which risk us to be infected. We then says, let's launch this psychological hub, which the nurses and the doctors or any healthcare worker, when they feel frustrated, they want to detox, instead of going to the tea room, they've got a number to call. They will find a clinical psychologist, they'll find a psychiatrist whom they can ventilate and vent on. So that's what we can do. But at the end of the day, the healthcare worker is equally an individual like me and you. They must take charge of their lives. It's still in their hands. We can do our part as government, but also we expect them to do their part. But lastly, as a comforting, is that when the Premier announced all those healthcare workers that have been infected, as a province, Limpopo, today, up to now, we have not registered any single death of our healthcare worker. Either it's a nurse or a doctor or a cleaner who is employed by the Limpopo Department of Health. So as a province, when we see what is happening in other provinces, we get scared, we get worried, but we are still comforted that our recovery rate in terms of our healthcare workers has been 100% up to so far. Thank you.
I'm not used to being served, so I'm enjoying these privileges of being sprayed. I hope it will continue. Thank you very much, Mr. Premier and the MECs who responded to the questions. I see, are there any hands that are being raised from the virtual friends? Tawani, your hand is still raised, you must switch off. Can we take the last 4 questions and then we close this media conference? I think most of the questions have been responded to adequately. What we will do, I'll take new questions before I do follow-ups so that we cover all others. There's only one new question, Nelly, and then follow-ups from ETV and okay. Sadiq says his is not a new question.